You may have heard of the acronym NICO. What does this mean in biological dentistry? NICO stands for Neuralgia-Inducing Cavitational Osteonecrosis. And what this means simply is that there is a cavity, there's a space in the jaw which is not healing, and instead of being filled up with bone after an extraction or any form of bone removal, it still forms a cavity which is empty. Very frequently we find some fat cells in this area and the patient is uncomfortable. The patient presents with pain. They're unable to actually say what sort of pain they have, but they know they have pain. The pain bugs them when they're running, when they get up from their sleep, and very commonly it irritates them to the point where they can't function properly. This can be a condition which lasts for many years when there isn't a diagnosis reached. How is this diagnosis reached? Well, firstly the patient has to come to us. A CT scan is typically done. With the symptoms and the CT scan, we should be able to try and find a particular area where the bone has not healed well. Now let's look at common reasons as to why this happens. Following a wisdom tooth surgery, for example, sometimes the area where the wisdom tooth is removed is not completely cleaned up. The word we use is curettage. Not just curettage, removing every single part of the periodontal ligament in the area. Now, if we want to improve the success of extraction, sometimes we use additional tools. The commonest tool that we use is ozone. Now, ozone is safe. It's oxygen, and that breaks down to normal oxygen as well. Now, when you use ozone, it chases all the bacteria into all those small bony areas. In bone, there are many little holes, and in those holes, bacteria can hide. With ozone chases those bacteria down those holes and tries to remove as much as we can't see with the naked eye. In addition, we'd commonly use something called platelet-rich fibrin. With platelet-rich fibrin, not only do we get a better result in terms of one, pain reduction, we also get improvement of healing because there are lots of growth factors in PRF. So we find that patients who come in for NICOs will complain of pain that is atypical. They've typically seen plenty of doctors, dentists, sometimes neurologists, and when they come to us, the diagnosis is reached, and then we do very simple surgery, which is to remove the area of where the NICO is, and then we do ozone therapy. We may sometimes even place an implant in the area if necessary, and of course with PRF. After a NICO is removed, you will be able to see a huge amount of improvement in that particular patient's life.